I will be administering a subcutaneous injection. I'm in the medicine room now. I'm just going to go ahead and start preparing my medication. First thing I need to do is I need to wash my hands. I will apply, let my hands dry. Okay, I will apply clean gloves. And I'm going to check my MAR twice against the medication for the 7 rights of medication administration. So I'm going to be administering 5 units of regular insulin and 5 units of NPH to Charlene Allen subcutaneously, to be documented later. The time is now, and this is for diabetes management to control glucose levels. Once more, Charlene Allen, 5 units regular insulin, 5 units of NPH to be administered now, subcutaneously. The time, to be documented later. And this is for diabetes management to control glucose levels. All right. So now I'm going to begin preparing my medication. I need to roll my cloudy. I'm going to roll my NPH. Okay. I'm going to take off my caps. I am going to clean my valves, sterilize my valves. I would turn it to another side and dispose of that. Now I'm going to begin by withdrawing 5 units from my cloudy of air. Alright, I withdrew 5 units of air from my cloudy and inserted it back in. Now I'm going to withdraw 5 units from my clear. Oops. While it's down on the table. Correction. Make sure I leave the valve down so that I can see it. Alright, withdraw 5. I'm inserting my air back in. Now I am flipping it. I am withdrawing 5 units from my clear, my regular NPH. I scooped it back up to show my proctor, 5 units. Alright. Now I am going to withdraw 5 units from my my cloudy sipes. So that I can now show my proctor that I have a total of 10 units, 5 units of clear, 5 units of cloudy, and recapped. I would I would remove my gloves, I would wash my hands, and I would have my medication with me as I'm entering the patient's room. All right, I would knock on the door. I would provide privacy. I would put this down on the bedside table. Washing my hands. I would then put on gloves. Hi, I'm Simone. I'll be your nurse for today. Could you please state your first and last name?
Charlene Allen.
And your date of birth?
September 6, 1956.
All right, and I am confirming by looking at the patient's ID bracelet. I have Charlene Allen, 9656, date of birth. Okay, the doctor's ordered for me to administer insulin today. This is for diabetes management. I'll be giving this to you to control your glucose levels. You may experience some discomfort. If you do so, please let me know. Did you have any questions?
No.
Is it okay to proceed?
Sure. Yes.
Okay. All right. And so now I'm going to make sure that my patient is elevated in a comfortable position for the injection. Patients, right now the head is elevated and the patient's sitting up. Could you please lay down? Okay, patient is actually laying down, I'm sorry. Patient is laying down so that I can palpate the area. All right, palpate the area. Don't feel any distension, it feels fine. All right, and so now I am just going to I make sure the patient's laying all the way back. Head is now lowered, and I'm just going to pinch the area so that I can just make sure the area that I'm holding is about the size of me. I do notice that the site of the last injection, so we're going to do it on the opposite side. We're actually going to do it to the right. The left side was the left side that was injected. So now I pinch the skin. I'm going to clean it with an alcohol swab. All right, we are about 2 inches to the side of the umbilicus is where I'm positioned. And now, with my gloves on, I am pinching straight down, 90-degree angle. I insert all the way down. All right, I remove the needle. I engage the safety. This would be in my sharps container. I will put this in my sharps container. Now I am getting another alcohol swab. I am holding it down. And the first time I did move it in circular motion. At least I think I did. All right. And so I will be back to check on you. I will be back to check on you, and well, I'd stay with the patient for maybe about 10 or 15 minutes just to observe the patient and their reaction to the shot, and I would just record and document that I just gave the shot, make sure the patient is back in a comfortable position, best and lowest position, call light is within reach, and skill is complete. I would remove my gloves and I would wash my hands.